In this lecture, we will see various factors affecting drug absorption. They are classified into factors related to the drugs and factors related to the body. And the first factor related to the drugs is the lipid water solubility of the drug, which is classified as lipid and water solubility coefficient. So, lipid water solubility coefficient is the ratio of dissolution of the drug in the lipid compared to the water. So, greater is the lipid water solubility coefficient, more is the lipid solubility of the drug, and greater is the absorption. We already studied the lipophilic nature of the drug favors the drug absorption. So, that is what defined in this ratio. If more is the lipid water solubility coefficient of the drug, greater is the absorption, and if the less is the coefficient, less is the lipid solubility of the drug and less is the absorption. The next factor that affects the absorption is the molecular size of the drug. If the molecular size of the drug is smaller, the absorption is greater, because smaller molecules can easily undergo passive diffusion compared to larger molecules. So, larger molecules have to undergo either facilitated diffusion or endocytosis for the absorption process. So, the molecular size is small, the absorption rate is more. The next factor that affects the absorption of the drug is the particle size of the drug. Particles may be either composed of the single molecules or more than some 100 molecules. So, if larger is the particle size, the diffusion rate is slower. If particle size is larger, diffusion will be slower, thereby the absorption rate is also slower, and vice versa. If the particle size is smaller, it undergoes the faster diffusion and the absorption rate is more. And the next factor is the degree of ionization. We already saw acidic drugs exist in the unionized form in the acidic pH. So, unionized forms are better absorbed in the acidic pH, whereas basic drugs they exist in the unionized form in the basic pH. So, unionized form of the drugs are better absorbed. So, acidic drugs are better absorbed from the acidic compartment, whereas basic drugs are better absorbed from the basic compartment or the basic pH. The next factor which affects is the physical form of the drug. Drugs either exist as the solids, liquids or gaseous forms. Gaseous forms are absorbed rapidly when compared to the liquid dosage forms. Liquid dosage forms are absorbed faster when compared to the solid dosage forms or oral dosage forms. Next factor which affects the absorption of the drugs is the chemical nature. The chemical nature of the drug is responsible for selection of the route of administration of the drugs. Drugs that cannot be absorbed by the intestines are given by the parenteral route. For example, heparin, which is a large molecular weight drug, it cannot be given orally. Similarly, benzyl penicillin, which is degraded in the GIT, so it cannot be given orally, it's given parenterally. And salt form of drugs are better absorbed than the organic compounds when given orally. So, organic compounds are given by other routes other than the oral route, and drugs in the inorganic forms are better absorbed than the organic forms. For example, iron present in the Fe+2 form is better absorbed when compared to the Fe+3 form. The next factor which affects the absorption is the dosage forms. So, dosage forms affect the rate and extent of absorption. Drugs can be given in the form of tablets, capsules, or transdermal packets. Example is nitroglycerin, which is given by sublingual route. It's placed under the tongue. So, this disintegrates and dissolutes rapidly, but it stays for a shorter duration of time. But when drugs given orally, they disintegrate slowly and stays for longer duration of time. So, both disintegration and dissolution, if occurs rapidly, the absorption rate increases. If the disintegration of the dosage form and dissolution occurs slowly, the absorption rate is slower. To the factors related to the body, the first factor related to the body is the area of absorptive surface. So, if greater is the area of absorptive surface, greater is the absorption rate. So, most of the drugs are given orally because of large area of absorptive surface, so that greater absorption occurs. So, when you see any patients where there is an intestinal resection, it decreases the surface area, leading to the decreased absorption. Next factor is the vascularity. So, more is the blood supply, more is the rate and extent of absorption, and vice versa. If you see in patients with shock, there is a decreased supply of blood flow to the GIT. So is the oral route of drug administration is affected. Because the blood flow to the peripheries is decreased, so absorption in those areas are diminished. Therefore, intravenous route is preferred in the patients with shock. The next factor affecting the absorption is the pH. We already saw acidic drugs favored absorption occurs in the acidic pH, whereas the basic pH is better for the basic drugs. And the next factor that affects the absorption is the presence of the other substances. This is an important factor because foods or drugs, they may interact with other drugs to alter the rate of absorption. Especially when given orally, foods can increase or either decrease the absorption rate. We can see a plenty number of examples for this. Generally, iron is contraindicated with milk because iron, when given with milk, it has decreased absorption. Iron in the presence of milk, it decreases the absorption. And the other example, vitamin C, it enhances the absorption of iron. Therefore, generally iron tablets, when taken with any citrus juice or orange juice, it enhances the absorption of iron. Similarly, milk, it decreases the absorption of tetracyclines. The next factor that affects absorption is the GI motility. GI motility must be optimal for absorption of the drugs. It should not be more it should neither increase nor decrease, which may affect the rate of extent of absorption. So, different diseases or drugs may alter the mobility. For example, diarrhea causes rapid peristalsis, decreasing the contact time of the drug, and thus the extent of absorption is affected. How diseases affect the rate of absorption? Diseases like diarrhea, it decreases absorption because of the decreased contact time of the drug. And some malabsorptive syndrome, they decrease the absorption of the drug. And the condition called achlorhydria, where acidic medium for acidic drugs is affected. And the other diseases which affects the absorption of the drugs are cirrhosis. It affects portal circulation, thus it affects the metabolism of the drugs.